5 of the biggest Medicare insurance companies just made a decision that's going to make your life a lot harder, and they're doing it all while telling you it's all for your own good. This video is going to be a little bit different from my usual Medicare education content because today I'm sharing my opinion on something that's happening in the insurance industry that I really think y'all need to know about. United Healthcare, Aetna, Cigna, Blue Cross Blue Shield of California, and Elevance Health have all decided to cut some form of commission payments to independent brokers like me for enrolling people like you in certain Medicare plans. Some eliminated commissions entirely for PPO plans, others just stopped paying brokers altogether for specific markets. And when they announced these cuts, guess what? Their stock prices went up because why not? Wall Street loved it because cutting broker pay means more money in their pockets, even if it means people on Medicare get less help navigating this complex system. These companies are basically saying they'd rather pocket the money that they used to pay to brokers than let their members get the help they need to find the right Medicare plan. Let me be crystal clear about what this really means, because this isn't just an industry issue. It could directly affect your Medicare coverage in the future. When insurance companies cut broker commissions, they're not doing it to save you money or add extra benefits to your plans. They're doing it because they want you to enroll online directly or through their call centers where nobody's fighting for your best interest. Here's what happens when you don't have an independent broker on your side. You get steered toward the plans the insurance company wants to sell you, not necessarily the plan that's best for you. Their call center agents work for them, not for you. Their websites show you their plans first. Even if a competitor has better coverage or lower costs, you'd have to actively go out to that other carrier's website and find those plans. Please remember, your best resource to see all your Medicare options is Medicare.gov. Without a broker, you're navigating 40 plus Medicare Advantage, Part D, and supplement plans in most areas completely alone. You're comparing formularies, provider networks, benefit structures with zero guidance from someone who knows what they're looking at and knows what to look for. And working with an independent broker like me or any of my competitors out there costs you absolutely nothing. The insurance companies pay us, not you. So when they cut our commissions, they're literally just choosing to pocket money that could help you get better coverage. But let's talk about what's really happening here, because these commission cuts aren't happening in a vacuum. Insurance companies are also eliminating PPO plans left and right. PPOs give you the most freedom in a Medicare Advantage plan. You can see any doctor, any specialist, and out of network without referrals, but they cost more for insurance companies to manage. So first they cut the PPO plans that give you the most choice, then they cut commissions for some of the remaining plans, making it harder for brokers to help people. It's a 1-2 punch designed to push everyone into their cheapest to manage plans. United Healthcare alone eliminated commissions for more than 100 Medicare Advantage plans across more than 20 states. That's not a small percentage. That's a systematic effort to reduce the number of people available to help people like you navigate Medicare. And this is happening right when Medicare is getting more complicated than ever. Formularies change mid-year, provider networks are changing year over year, star ratings are being recalculated, and prior authorization requirements are getting stricter. These insurance companies know this. They know Medicare is confusing. They're counting on it because when you're confused and overwhelmed, you're more likely to just pick the plan with the lowest premium or the biggest advertising TV budget. And 9 times out of 10, that's not the plan that's going to serve you best when you actually need to use your health care. This ties directly into what I talked about in my star ratings video. Insurance companies are in full profit protection mode right now. Medical costs are rising. Medicare reimbursements are shrinking, and they're cutting everything they can to maintain their profit margins, including the people who help you navigate their own products. So if you're trying to choose a Medicare plan during annual enrollment, I think you're going to have fewer brokers available to help you. And here's the reality. Brokers are running businesses. They're not charities. If a broker helps you enroll in a plan that doesn't pay them a commission, you might not get the same level of ongoing support throughout the year. It's just the economics of how this works. I'm sorry to say it, but that's why it's so important to find a broker who's upfront about this reality and will help you weigh all of your options, including what kind of ongoing support you can expect if you go with a plan that doesn't pay them. It's a broker's fiduciary duty to help you find a plan that's best for you and not their paycheck. You're going to see more pressure to enroll online or through insurance company call centers where the person helping you works for the insurance company, not for you. And you're also going to see fewer and fewer PPO options overall because insurance companies are systematically removing some of these PPO options from their listings. But here's the thing, I'm still here. I'm still fighting for my clients because that's what independent brokers do. We put our clients first, even when the insurance companies make it harder for us to do our job. The insurance companies are betting that people like you will just accept less help and fewer options, and I want to bet them wrong. Don't let insurance companies push you toward their cheapest plans just because they don't want to pay someone to help you find better coverage. I'm Callie, a licensed insurance broker and certified Medicare expert. When you work with me, I'm fighting for your best interests, even when the insurance companies try to make that harder. Call me or schedule an appointment to review your Medicare options for 2026. Remember, it doesn't cost you anything to work with an independent broker. So I encourage you to find someone you like and trust. And yes, I'm encouraging you to work with any broker out there. Maybe it's someone else on YouTube, because at the end of the day, it could save you an out-of-pocket cost. And if you've got questions about how these commission cuts might affect your Medicare options, drop them in the comments. I read and respond to every single one. And if this video opened your eyes to what's really happening in the Medicare industry, please like the video and subscribe to the channel. And click right here for my next video with more Medicare insights like this. Thanks so much for watching, and I'll see y'all in the next video.